Welcome to the Shift podcast, where midlife, medicine, and mindset meet. We're breaking the silence around women's health and simplifying the path to feeling strong, clear, and better than ever. Hosted by me, Heidi Swap, with insights from Dr. Vohn Watts and stories from real women, the Shift podcast is here to challenge the narrative, empower you with information, and create a new vision for your next chapter. Welcome back to the Shift podcast. This is we're super excited because this is our first remote podcast today, and we have a very special guest. And Dr. Fong, so appreciative and so excited that you're going to be here, that you're here with us today. And I have a really special connection, and we're going to get into that. But first of all, me and Dr. Dr. Vohn. I was going
to say, you're going to have to say her name slower.
Here's my problem is that
you got Dr. Fong and Dr. Vohn.
Right. And here's the thing. So I can't remember names very good, so I have to spell them in my head. But I know somebody named Vohn, and it's Vaughn.
Yeah, I'm a rarity.
And the Vohn is wild. And so then I think John, but I get Vohn. It's tricky. This is my brain problems, Dr. Alina. Okay, so
we're going to talk about that.
Joining us today is she's just a specialist in the whole world. She's you're like a global brain phenomenon, which is so cool because her clinic that she co-founded is here in Orem. We're actually podcasting from Orem. And I'm just going to kind of read some of this. She is a neuropsychologist, and she's, like I said, co-founder of Cognitive FX. Now, if you've followed me for a while, you know that my daughter experienced some brain trauma. And so this is where Capri went. And so we'll talk about that a little bit more. What makes this so unique is, or her work so unique, is that they use brain imaging and compassionate patient-centered care. I love that. To help people heal their traumatic brain injuries. So I think that my belief system used to be that if you hurt your brain, you were stuck with it. And what Dr. Fong and what they do at Cognitive FX is amazing. And so we're going to talk about that. She also has 3 girls who are dancers, and she is married, and so she is juggling all the things like business ownership, research. You're also a PhD. So could we start out with you just kind of telling us about your background and your path and how you ended up leading the world in brain trauma healing?
Thank you so much, Heidi, for inviting me on here. And you also hold a special place in my heart, and so does Capri. And so, thank you for giving me the opportunity to meet you and to meet the people that are listening to you, and to also meet Dr. Vohn Watts.
Impressive. So
just a little bit about myself. I have a PhD in clinical neuropsychology right here from Provo, Utah, actually. I graduated from BYU. Go Cougs.
That might be a little controversial on this podcast. Just saying.
We're all about the controversy.
Isn't it all about just appreciating people for their differences, right?
Yes.
It should be. Yes.
But just so you know, my oldest daughter is at the U, and so she's the first one in our entire family who's red, and so I embrace it all at this point.
Excellent.
I had the wonderful opportunity to attain my graduate degree, my PhD from BYU as well. I studied under Dr. Aaron Bigler, who is probably the most preeminent neuropsychologist of our time. I really believe that. Wow. He really pushed me towards neuroimaging. And so this is why I have found myself very comfortable. I started in EEG and then found myself very comfortable with fMRI and MRI. And that's where I live, is in this world of advanced neuroimaging. And for those of you who have been familiar with Capri's story, she came to my clinic called Cognitive FX here in Provo, Utah. And we actually specialize in functional MRI, task-based fMRI where she was in my MRI machine, but rather than just taking, static pictures, we actually had her do neuropsychological cognitive testing, and we can actually map out how the brain works, how it's firing, how it's functioning, even when people look as normal as Capri, right? Because I think that's part of the problem with my patients is that they look so good, they look so normal. And so there really isn't this understanding, empathy, or sympathy towards some of these brain conditions.
Well, I remember you have to hold still so it looks like an MRI machine. If anybody's been in an MRI machine, it's like, lay still, don't move.
It's not fun. When I broke my neck in the Marines,
right.
I'm in there and don't move, and you're like, for how long?
Right.
Until you get out.
And I was listening, so I had, I knew what they were asking her, and she had like this, like, video game controller type thing, and she, through a mirror, without moving her head, could see what was on this computer screen. And so things would come on, and so then they would prompt her. And I mean, I'm sure that those prompts were designed to trigger, I mean, you can talk about different parts of the brain, but this is the funny part. They're like, okay, name off things that are red. And she was like, red pants, red shirt, red lipstick, like I was like, tomato, apple, like she physically couldn't think of items that were red. And when she came out, I was like, red pants, just kind of teasing her. But I think, as a mom, and I have shared here on this podcast that I have a son who passed away from suicide. And when we were in the process of doing the donor work after he had passed away, the donor team is sitting there and going through every aspect of his health. And they said, well, tell us about this traumatic brain injury that was in this month. And I was like, a traumatic brain injury? I don't know. And he had a concussion, but nobody had ever framed it that way. I didn't know anything about it. And so it really wasn't until after that I started to learn how impactful a brain injury is on not just your ability to go to school, but in his case, it changed his personality. And the change in his personality, not understanding it, really affected the way he perceived himself. And so when my daughter got hurt, and this was just only a year ago, and Capri's a dancer, and she, we could see her injuries. Her injuries were on her face, and the biggest impact was up here on her forehead. So that's where she hit first, but most of her injuries were between her forehead and her cheek. And pretty soon, I started really noticing changes in her personality and her confidence and in her desire to be alive. And then, it had been 6 months, so she thought she would try to dance. And she couldn't do any, she could do it physically, but then it would cause her to black out, and it would cause her to be super dizzy. And then I started being really scared, and I thought, oh, this is a bigger deal. And you go to the hospital, and in the emergency room, they gave her the CAT scans, they gave her whatever scans you get in the emergency room. And they're like, so they said she likely has a concussion because she hit her head. Yeah. But it is impossible. I thought it's impossible to know what is wrong. And the protocol is stay off your phone, sleep.
Cocoon. Yep.
I couldn't get this girl to get off her phone. You know, like that was hard. So when we went in, and I'd like to just kind of have you speak to this, like when somebody does the fMRI, what happened was I saw, it was like right before Christmas, like maybe the day before you guys closed for Christmas, and you did this special that you could get the fMRI for like $200 or like it was some special price. And so we went in and then we had a Zoom call with you. And so talk about what that fMRI tells you.
Okay. Yeah, so I just want to be clear. It wasn't 200. We probably did a special for that. It was probably more like, no, it was probably $1,500. Yes.
Oh, okay. And I can't, whatever it was a special
showing
price.
Up to your office.
Yeah, I was like, everyone's going to be knocking down my door.
Okay.
Heidi said it's $200.
I'm sorry.
Like, no, it's okay. No, we do a special usually around Thanksgiving and Christmas.
Okay.
And Labor Day. And the reason we just have these just specials there. So, but we actually can offer the scan for about half price. So that's when you were able to come in and get it done.
Okay.
But more importantly, the fMRI. So what we're actually looking at, okay? So just to give you a brief overview of fMRI is, you're right, we use the same exact MRI machine, Heidi, but there's different software and there's different types of tests you can do with an MRI machine that are more advanced. And with this particular test, you're right, she's in the MRI machine and she's doing like, the test that you mentioned was what we call a verbal fluency test or a semantic fluency test or a category fluency test. So it's her ability to come up with as many words in a certain category as she can. And that incorporates a lot more cognitive ability than you would think.
Oh, I have a problem in that area as well. I mean, like here I am teasing with her, but like...
You got the scan yet?
No, and I'm afraid to.
But yeah, it does, because, you have to try to restrict your thoughts to that category. We can pick out if thinking is really rigid, like Capri's was when she was just like red pants, red lipstick. That is not what this test is. That's not how you're supposed to respond, but it does show us, how her brain is firing and functioning. But it also helps us see how well people can filter out their impulsivity or, different responses. For example, one of these verbal fluency tests is telling us all the words that you could think of that start with the letter F. And you'd be surprised how many profane words come out of some people's mouths, right? Because of a brain injury. Yeah. And so there's so much information that we get, just what they're saying and how they're saying it and how quickly they're coming up with things. But of course, with the rules and restrictions that we provide, we can see if they're staying within those rules. But more importantly, so what's really special about the scan is I'm not as concerned with the words that she's giving. I'm looking more specifically at the parts of the brain that should be activated when doing a verbal fluency test. And this is really what sets a lot of our patients apart, is that a lot of the other testing they can do, Heidi and Dr. Watts, like they might pass a basic attentional test, or they might pass like a screener, like a MOCA, or what we call like a mini mental status exam. They might pass that with flying colors. So people might think, oh, they're just fine cognitively. But the truth is, when we actually can measure how the brain is using energy, how it's metabolizing oxygen in order to fire, and oxygen is the brain's main fuel source, okay, then we can see the real discrepancies. And a brain injury is a neurometabolic crisis issue, okay? So the brain is really not using energy in the way that it should. And there might be some parts of Capri's brain that we're overworking and overactivating and hyperactivating and compensating for some areas in her brain that were not firing and were more dormant. And so the fMRI, in a nutshell, picks up on which parts of the brain are using more oxygen and which parts are just kind of sleepy.
So question for you, because
Sure.
I already know, just like in the world I'm in the more, holistic, natural world, one of the first questions, and I'm sure you get these questions, is the concern about radiation. So can you talk to that?
100%. The reason, and I love how you lobbed this over to me. So I love.
Oh, is this an easy question? I was hoping this wasn't going to be on the spot kind of question. So, but I know people really. I mean, this would be a real question. I'm sure that you get this in your office. So I know people will be asking for those that are like, oh, should I go do that? That'd probably be a concern for some people. So I'd love to hear you.
You know, and you and I, we are on the same team because we try to avoid anything invasive. We don't really like medications either. And that's part of the reason I gravitated and I was drawn towards MRI, because with MRI, there's no radiation, okay? It's not like CT or X-ray. And with the fMRI, there's no radioactive tracer. We're not injecting any contrast. And so with MRI, you know, pregnant women can do MRIs. They can do multiple MRIs. We actually do 4 MRIs within a given 1 to 2 weeks. And MRI is really one of the only modalities that you can do this without any sort of radiation exposure.
And thanks for explaining that, because you know that the majority of people assume that it does have radiation. Exactly. And so that's why I wanted to bring that question up, because I know there's going to be a lot of people assuming, well, CT, X-ray, they all, MRI, they all have. And so thanks for answering that, and it's super impactful, especially in the brain. I remember when I walked in my first neuro class, and the professor walked in and he set a cup on the table like this in this room. And he says, the wave of medicine of where science is going to take us is continuing to map out the brain, because the amount of knowledge that we currently have about the brain, if the brain were the size of this room, we could fill this cup. And so it's so fascinating.
And how long ago?
This, gosh, I don't know, 13 years ago. And so, I mean, and they didn't have, even back then, they weren't doing fMRI back then, this brain mapping. And what people don't understand, and actually, let's have you explain it. You're you know, obviously I'm a chiropractor, and for those that don't really understand chiropractors, we're central nervous system experts. That's what we do. So explain why it's so important, because there's parts of the brain. Well, the parts of the brain do different things. And so, and for those that aren't familiar with the brain, they just think, oh, the brain's the brain. It's like, no, there's a reason why when you have a head injury to the frontal lobe, personalities change, or there's reasons why you have, a brain injury to the back of the brain, so there's different things that happen. So can you kind of explain just like the brain, go through the brain and kind of how it maps out and what parts of the brain do what? Because, a lot of people they've hit their head at some point and they have an issue. Like maybe they have some, ever since I hit my head, my vision's kind of gone down. Well, what part of the head did you hit? So if you could kind of explain some of that, I think it'd be fascinating for them to hear.
And I would say that was 13 years ago. And I would say right now we could probably fill 2 cups.
Okay.
Which is but that's exciting to know that, because that just means the advancement that we will have over the next 10, 20, 30, and now with AI, the increased advancement is going to be, this is a great field to be in. I'm sure it's a very exciting field to be in.
It is. And honestly, Dr. Watts, that's exactly why I chose to do what I do, right? I could have gone into any field that I wanted, but the truth is neuroscience, the brain is the only organ in the human body that we really still don't know a fraction of, we don't know what it can do. And so I wanted to be in a field where there is going to be still so much innovation and just advancement. So that's why I chose this in a nutshell. But yes, let's go through some of the basic brain regions, brain structures. I mean, again, I've taken like whole courses in neuroanatomy, but I'm going to just break down kind of the main lobes of the brain, and just kind of let's start there.
Great. So
we have this front part of the brain here is called the frontal lobe. And this is where the CEO is, okay? So this is the parts of the brain that control decision-making and weighing out pros and cons and, just multitasking. So all the things, the hard things that you have to do, all right? And what's interesting is that this frontal part of the brain is the last part of the brain to develop. And so for those of us with teenagers, okay, and myself included, I sit there going, okay, I know about neuroscience. I know her brain's not developed yet, but why the heck did you just do that thing? Why did you decide that was a... We have to be able to cut our kids some slack, right, to some degree, because this frontal part of the brain actually doesn't finish up its development until about age 26.
Okay.
All right. So
is it different in women and men, or is it about the same?
Yes, there are some studies that say that that women's and men's brains are very, very different, actually, and can develop a little later. And unfortunately for men, their brain tends to finish developing maybe a little bit later than women. And women tend to be more about 26. Sometimes men can finish about 26 to 28 even. There is a bit of a range. And of course, there's individual differences for everything, right? Okay, so that's the frontal lobe. And then we have this big area back here. And I call that occipital lobe. It's right back here. And what Dr. Watts was referring to of the brain, okay? And the reason why this is really important is because whenever we have a patient that is really complaining about the visual aspects, and I'm dizzy, or I maybe even have headaches, this could actually result from the fact that their vision might be impaired. And that occipital lobe is quite large, okay? And so any sort of hit to the back of the head, whether it's an initial hit or a secondary hit, like a coup contra coup hit, could really affect the brain. And so I want to make sure that we pay special attention to that occipital lobe, okay? The next lobe I would want to kind of focus on would be the temporal lobe. And the reason why it's called the temporal lobe is because it sits kind of right by the temples, right here, and it kind of goes back this way, okay? This part of the brain is primarily responsible for auditory information, processing that auditory information. It's responsible for word finding, verbal fluency even, okay? And even some emotional processing and memory, okay? So that temporal lobe there. And then last but not least is the parietal lobe. And the parietal lobe is right about here, okay? And this has to do with motor control, sensation, touch, temperature, and so on. Okay, so those are the four main lobes of the brain. We can go into more detail if you want to, but
I think this is good.
Depending on where you get hit, right, that can really affect what your primary symptoms will be.
I thought it was also interesting when we got our printout of Capri's results. There was like, you're tracking the left side and the right side of the brain. And, we've all heard that, like, are you left-brained or are you right-brained type of a thing. But it was, we could look and see that, like, maybe in this area that the right side was really overactive, and that maybe the left side was really underactive, and what you wanted it to be like in the middle. So there was kind of like a baseline and then like super high and super low. And she may have in one area super high and super low. And then by the end of the week, the goal was to start getting them to come back together. And that's really what we saw.
We want balance. So the body loves balance, the brain loves balance. And when we're going to talk specifically about Capri's scans, yes, she had some parts of her brain more on the right side than the left that were overworking and overactive. And then the left side seemed to be a little more hypoactive. And, when we see that type of pattern, what could have happened is that there could have been more swelling and inflammation that affected the left hemisphere versus the right hemisphere, okay? And when you see that imbalance, you can see kind of like this tug of war almost, this kind of unsteadiness in the brain that can lead to a lot of compensatory activation that can lead to a lot of symptoms. When the brain is not balanced, and Dr. Vohn Watts can actually talk to this probably much better than I can, but if there's any sort of orthopedic injury, there's going to be some compensation, some limping on the other side. But if the issue doesn't get corrected, the part that's limping along, okay, is going to start to have major issues too. And so the reason why we want the brain balanced is because this compensation is not healing. And at some point, the areas that are overworking are going to say, we're done. We have to get back to balance because we've been carrying this load and this burden for too long.
And that's a great example, because like for somebody who's got a little hitch in their giddy up and they're kind of, compensating, like say it's a knee issue, well, I can tell them right away. It's like, if you don't get that fixed, you're going to have a hip issue.
On the other side.
Well, even on the same side, because now you're compensating. So the entire body works that way. When you compensate and you don't get back to that balance, you're going to put undue stress somewhere else until you've kind of burnt that one out. And so that's a great example. But can we shift gears just a tiny bit? Mm-hmm. Because I know there's such a concern, because it's all about the brain stuff, right? But there's such a concern, especially now. And actually, what are the numbers? I know they've probably shifted. What percentage of people get dementia, Alzheimer's, these brain conditions? Was it last a long time ago when I was around, this was like 50% over like the age of 74 or something like that.
I actually think it might be more than that. This
just goes to show how quick things shift and move. Yeah.
One of the things that I will say is, oh my gosh, if you have a prior concussion history, honestly, that sets you up for a much higher risk for dementia and other neurodegenerative diseases. Okay, and so if you have a history of any sort of brain injury, then I think that risk for dementia jumps up quite a bit. If we're just talking about the general population, those numbers can kind of.
But it's pretty high. I mean, it's at least 50%, right? What is it, 70 or 74 or something like that?
No, I don't want to misspeak. I'd rather check and make sure. But what I do know, and again, because I'm all brain injury, my statistics are skewed towards brain injury and dementia. But I know that if you have a brain injury and dementia, then those numbers are closer to what we mentioned. In the general population, I'm not quite sure.
Well, let's stay there. Let's stay there, because this is a big concern. This is obviously a female podcast. Is really where we sit. And I can tell you, I have a son who played football and played rugby, and I have my youngest daughter plays rugby. And this is always a concern for my wife, which it should be, and myself. But I mean, the moms are concerned about this. And when I was coaching my son, I mean, back when that documentary came out in the NFL, you would be amazed at how much the participation in tackle football dropped, like almost dramatically within the next year. Like we had to combine with other schools because so many moms pulled these kids out. Mm-hmm. And there's also that balance of these, you wanting to be able to play sports. And they have the false notion that football and rugby are going to be the biggest causes, which crazy thing is, I don't know if it still is, but it used to be women's soccer was the number one.
Yep, soccer still. Yep,
cheerleading was pretty high. So it's not just football, rugby, it's soccer, it's cheerleading. Mm-hmm. It's a number of these. Yep. So you have that balance. Like us, we're a big sports family. We feel very passionate about sports because it does teach a lot of great life lessons. But there's that concern. It's like, okay, well, my kid's taking a few hits. Like, you guys are a rugby family too, and you've seen it, and you've seen the hits happen. And then you go, okay, well, you stay off your iPad and all that stuff for a week or two, whatever. But is that really the end all be all? Now we're good and moving on, or what else can moms do, parents do, besides just stay off your iPad for 2 weeks? Because like you said, the more, if you've had concussions, you're going to have higher rates of some of these neurodegenerative diseases later in life, which as a parent, I just think about it right now. I'm like, well, I don't want my son or daughter to be a higher risk. So I'm assuming there's things that they can do. And this is probably exactly what you do. So enlighten me. Because even myself, I would love to know. Because for me, it's even still dealing with the concussion protocol. It's, stay off electronics for 2 weeks and rest. And it just seems so remedial for the organ, which is the most complicated organ in the body.
This is what stresses me out.
Well, okay. I'm going to try to de-stress you a bit, okay? And it's interesting because one of my cousins, she's my first cousin, and she has a son that's playing football, and she called me with the exact same question because she was doing a deep dive, and she's like, should I still let him play? He's only a freshman, but he loves it. And, these are the really hard questions to ask because, these kids play these sports because they love these sports. And we have to balance that with, okay, how do we be safe without taking away something you love, and some emotional and psychological harm that can come from pulling them from something that they could potentially love and thrive at. And like Dr. Watts was saying, there's so many good things with team sports too, Well,
and I'm just going to add one concern as a mom is, my husband got really vigilant with his athletes, and he's a rugby coach and a hockey coach. You could tell that those kids were lying when they would, did you see stars? Nope, no stars. Did you black out? Nope, didn't black out, because they don't want to get pulled out, and so.
So the concussions that are reported are definitely a lot less than what's really happening, because I know the same. I remember I was in football, like you'd see star. I mean, it was a joke. You're like, oh, I'm seeing Tweety Bird, and you just get back in the play. And so, I know that kids, I know how teenage boys are. They're going to lie through their teeth to stay on the field.
100%. And a lot of the baseline testing that we were trained to do for a lot of these students, we actually found weren't that helpful, because a lot of times these young kids would sandbag the initial baseline test. So if they ever did get a concussion, their scores, you're the same.
Smart.
So
they're freaking smart.
They know. So the bigger thing is this, like as a parent, like for me, and my wife keeps talking about it, our kids are playing these sports, and there's no way they're going to stop playing them. I'm not going to be able to, they're adults now almost. The youngest is almost 18, but my son is playing rugby in South Africa right now, and he's an adult. But it's like, okay, well, what can we do, on the off season? What can we do when they're done playing sports? Those are the things. I know these are the kind of questions my wife would have, because this is a real concern for her. Mm-hmm. Well, for both of us.
He doesn't care about their brains.
I do care about their
brains. So one of the things that, so I want to make sure I answer the questions that you asked me at first was, well, what do we do about it? Because you're right, just this method of cocooning, and by cocooning, I just mean the method of, okay, just get off everything, go in a dark room, don't do anything, stay off everything until you feel better. That's actually not the right way to go anymore. And for about 12 years or so, 12 to 15 years, we were, at preaching in a sense from our clinics, like, we need to get you active. We need to get you active. And I remember presenting a lot of my early research and a lot of my clinical kind of case studies and say, no, we only rested them for maybe 1 to 2 days, and then we got them out active. But 15 years ago, I had doctors come to me saying, I'm going to kill patients. I'm crazy. You need to just let them rest. And I'm like, I'm in the trenches with these guys. I'm not in my ivory tower doing research. Like, I'm seeing them, and I'm finding that the longer we let these kids just cocoon, we're seeing a higher incidence of depression, of suicidality, right. Of just a loss of friendships, even socially they're struggling, and so we just kind of started to do these like ends of one and ends of twos, and just saying, okay, actually, let's get you exercising a lot faster. And this method was actually backed up by a friend and colleague of mine named Dr. John Letty and Dr. Barry Willer, who is a neuropsychologist, and Dr. Letty is an MD sports medicine doctor out of Buffalo. And they came up with something called the Buffalo treadmill test, which is kind of this first test saying, hey, let's get these guys exerted. And John will tell you that he was laughed, out of rooms by his colleagues too, that are now coming to us saying, oh yeah, great idea, right? But we have to get them active, okay? So we shouldn't be resting these kids for really more than 1 to 2 days as a general rule, okay? So cocooning is fine, maybe for just 1 to 2 days, not 1 to 2 weeks. As soon as they're able, get them out, even if it's just like a little walk here and there, but get them out, get them a little physical, okay? And then, of course, make sure that you see a specialist, someone that knows what they're doing and understands how that activity is really important. So, and then with that, and I didn't want this to be doom and gloom, but I actually found the study, Dr. Watts, that I was referencing. And again, I don't want to be doom and gloom, but should I state these numbers here?
Because here's the thing. Truth and knowledge will result in change. And so when people realize what the reality is, that might be what is the catalyst to get them to change or to make do certain steps. So yeah, let's hear it. Let's be real.
Okay. All right. Now, again, I'm not trying to be this like harbinger of gloom and death. Okay. But this is a study that I've quoted quite a bit by these two researchers out of UW. And this research came out about 8 years ago. So I think it might even be worse now than it was then. Okay. But there we go. So their research actually showed, their study found that the risk of dementia increased 33% higher. Okay. For 2 or 3 traumatic brain injuries. So if you've already had 2 or 3 concussions, all right, that increased your risk by about 33%.
Wow, that's a lot.
If you've had 4 TBIs, that increased your risk by 61%. But then here's the shocker. If you've had 5 or more traumatic brain injuries, 5 or more, that increased your risk for developing dementia by 183%.
So now the question is there things that, what can they do after being done with the sport? Let's say that they're done with the sport, they're in between seasons, especially in sports that have a higher propensity for concussion. What are some of the things they can do to maybe help lower those percentages? Because otherwise, I think every single mom is going to be pulling their kids out of it. They're going to wrap them in bubble wrap.
That is a really serious number.
Yeah, this is a really serious statistic. And, it's interesting how a lot of these studies end up getting buried, because again, football is a machine here in the United States, right? And I've had the opportunity to work with NFL athletes. The first clinic we ever opened was actually not in Utah. It was in partnership with Tom Brady, TB12 out in Foxborough. And that was about 14 years ago. So, we've really catered to these professional athletes that are just so incredibly intelligent, so incredibly strong, resilient, with brain injury. But we've told them the same thing. We've said, look, you need to own your medical history, know what's going on so you can make the right decisions about when to maybe stop playing, when to maybe, find other hobbies and things that you like that may not be as harmful to you, but again, it really opened my eyes to the complexity of the decision of when to play and when not to play. Because, if you think, if you are an athlete that, you really are that good and you might make it to the pros, right? You're looking at something very different than maybe just like an average kid that's still getting 5 or more concussions. Mm-hmm. That's when a mom might come in and say, okay, let's be done. This is not worth your future, right? So this is very nuanced, and I really try hard to just kind of stay out of the decision-making process, but I do try to want to, arm you as parents, and all of us who are listening are parents, most of us anyway, with the right intel and the right information so we can do what's best for our kid. And the other thing too is, so many of these kids, they want to play, they want to do this, but remember, their brain is not developed yet. So, they might think they want to do this because that's all they can see, but that's when we need to step in as parents and say, okay, I know you want to do this, honey, but I'm here to protect you as well. This is my job, and I'm sorry, but yeah, this is your 8th concussion now, and I need to look ahead, So again, not the easiest decision, not the easiest conversations, but my job is to make sure that everyone knows the information, right? So to answer your question, especially for these NFL athletes and some of these professional athletes. In fact, we just had an Olympic gold medalist and 2-time heavyweight world champion come into the clinic for boxing. So if you think
I was just gonna that flashed into my head, like any of those MMA or.
Well, we have a guy. He's famous out of Boise. He's kind of like this was back when I was in high school. His name is Kenny Keene, in world champion a boxer, and you listen to him, and when people talk about punch drunk, like you listen to getting interviewed, and like it was painful to listen to. Mm-hmm. Like it was talking about aphasia, and talking about some, the sides of his head's getting beat up a lot. I mean, he did not talk like a normal person should talk, and it was definitely from brain injuries, big time.
So a lot of these athletes, actually, they come to us in their off season, and they come and they get their brain scans done, and we get a really good idea of where they're at, how to fine tune them, But again, these are, a lot of these are professional athletes that have the time to come down and spend with me every year. We're right next to BYU, and I can tell you we have a large number of BYU athletes that come as well. And come and get scanned. I am so proud to say that we sponsor the Cougarette dance team, and the Cougarettes for the past couple of years have been able to get baseline fMRIs with us because my heart is in dancing. I have 3 daughters, right?
And so you mentioned cheerleading, but dance. There's a lot of concussions in dance. And
oh my gosh!
And do they do the throwing and stuff in dance?
Yeah,
they do
the lifts and then a lot of acro in there, and so and the girls they want to perform at that highest level because that's what's going to get them the points. And when you're, at the level of Cougarettes, and I don't know what their injuries are like. I know in our high school team. It just breaks your heart when you've got 3, 4, 5 girls sitting out, because of concussions. Well,
and people like when I was saying when that whole NFL concussion documentary came out, gosh, I don't remember that was, but it was like 10 years ago, 12 years ago. Mm-hmm. What we found were a lot of kids that were playing on our football team, their parents pulled them from football and put them in soccer. And now, I'm not sure what it is here, but this was in Kansas. We lived in Kansas City, and it was just a few years ago, I think 4 or 5 years ago, in the state of Kansas, they banned you are not allowed to head the ball until I think 8th grade now, or freshman year or something like that. But it's like either 8th grade is like 14 years old or something like that. So now they're finally recognizing that even in soccer, where it's like, so they're, like I said, they're making it illegal to even hit the ball with your head until you're older.
Thank heavens.
Yeah. But it's also understanding that just because it's not football doesn't mean you're going to be immune to concussions. And like I said, I don't know what it is now, but back then, girls soccer was the number 1 concussed sport. And I'm not sure if that's the case now, but it was very high.
Now, you were mentioning that you had this high level Olympic boxer individual. And so could you even pinpoint when he had an injury, or was it just expected to always have it? Like always getting banged kind of around, that's a tricky one.
It's a tricky one. And, one of the limitations of fMRI is it's not like it's a tree where you can kind of cut a tree and you can see different rings and different years. We don't have that type of specificity. We can just see kind of cumulatively where everyone is at right now. But even for someone like that, it's very important for you to really get an idea of where your baseline is. And so for all those moms out there, and I hope you're not freaking out, okay, but for all those moms out there with kids in sports, it just really might be a good idea to just, when you do your annual checkups, tell your pediatrician even, just say, hey, just so you know, he's had this many concussions, because that way at least it's documented, all right? And if things get worse, then your pediatrician can send you to a specialist, but we need to document these types of things. And there's what I would recommend. So I have, if you go to my website, Cognitive FX, so the letter F and the letter X, so cognitivefxusa.com, and you look at all of our blogs, I've written like almost 100 articles about different symptoms and what to do about them. If they're struggling with school, if they're struggling with emotional issues, if your children are struggling with socializing, like they aren't as social as they used to. I have, articles about us as parents, if we have brain injuries, and even, in fact, we just published one, and we were joking about it as we're writing it because, being in Utah, it was an article all about sexual dysfunction after traumatic brain injury. And when we were writing this, I was just like, gosh, nobody really talks about this. We're still a pretty Puritan country, right? But I'm like, we need to talk about, if we're going to talk about menopause and perimenopause, there's so much that has to do with like endocrine issues, sexual dysfunction after traumatic brain injury. So I have almost everything you can think of
that's
with
a great
regards to
resource.
brain injury there. Yeah, so please go search those as parents. I have an article about what do I talk to my kids' teachers about? Like, how do I approach the school nurse about this and so on? And, so we just need more resources out there to deal with these types of injuries and to not feel so alone as parents or kids.
Right.
Yeah. And one of the things I usually recommend, and I'm not sure where you're at or if you recommend supplementation or anything, but, obviously, we have millions of mitochondria, probably trillions of mitochondria in our body. And in the brain, it's, what is it? I think on average, like 2 million mitochondria per neuron or something like that. And we have around 80 million neurons, some of that.
Jeez.
You can correct it. I don't know if I'm spot on there, but it's somewhat close. There's a lot of, so I always recommend 2 supplements personally. One is a really good mitochondrial product, mitochondrial support product, and the other one is like a really good omega DHA product. Thoughts? What do you recommend, or do you recommend? Because for me, I'm like, well, if they're still going to be plain, we should at least be proactive in trying to like we go to the gym to lift weights to get strong. Here, it's like, how do we maintain some strength in our brain? What are your thoughts?
I love that. In fact, those are 2 that we recommend quite a bit. We're also making sure that patients incorporate some magnesium as well. So magnesium is another one. And
okay, before you move on real quick, because next question is going to be which form of magnesium, because that's the very next question, because they're not all the same. So which form of magnesium do you guys usually recommend? Or is it a combination of different forms of magnesium?
Yeah. So, there are some, if you actually look on, and I don't know how you feel about this, but there's some that is really good on Amazon even. Like I get some supplementation on Amazon myself, but you have to like make sure which one. So for us, in our own clinic, we actually do, I think it's called magnesium L-threonate.
Which makes sense.
Threonate, threonate. So it's it's one of those, but it's magnesium L-threonate that we tend to like quite a bit. But yeah, like you said, even just omega-3. Like some people come to me and say, "Oh, I'm taking this omega-3 ALA compound," and I'm like, "Oh, well, that's for the heart. You should have been taking DHA." And they're like, "Oh, shoot, I don't know, right?" Yeah. So I know that there's others you can take, but that's the one that we tend to take a bit more. Now, magnesium glycinate is another one, because that can help with some, muscle tone. It can help for calming effects, anxiety and stress, and other things like that too.
Right. And these are all, and just for the parents that know or that are listening, these are all things that kids can take very easily without any real issues. As a matter of fact, I'll just be perfectly candid. Adults should be taking all 3 of these supplements anyways. I mean, these are all really good supplements to be on because the mitochondria, mitochondria throughout the entire body. So like that's the powerhouse of the cell, right? And did I ever explain to you my little, I always do my mitochondrial thing is like, think of a fire pit, and you got the rocks of the cell wall and the logs are the mitochondria and the fire is the energy, right? So the more mitochondria, the more logs you have, the more energy you can create, right? And so, especially if you have a traumatic brain injury, I would 100% get on all 3 of these with you have your kid or yourself or whomever it might be. If they get a concussion, that doesn't have to be a major traumatic. I mean, just even a low concussion, because I mean, you're probably going to have a much quicker recovery rate, and then keep them on them too, especially if they're in a sport that's a little more prone. And please don't be scared, because I coached football for 10 years. I love football. I love rugby. I love these sports, but I also know, like my childhood hero, I grew up in San Diego. I'm a San Diego Chargers fan, a San Diego Chargers fan. I didn't say LA Chargers fan for those listening. I'm kidding. But I mean, our hero was our hometown hero, Junior Seau. Yeah. And he's from San Diego, born and raised. And, and then I marry, my wife is Samoan. And so in that culture, I mean, he is the one that puts Polynesian on the map when it came to the NFL. It was Junior. And so, I mean, it struck a lot of people, when he took his life. And you go back, and it wasn't just him. It was like a couple other ones. Boom, boom, boom. Some were even, and a lot of them were deliberately shooting themselves like in the chest so they could preserve their brain, because they knew something was wrong with their brain. And they had this, CT, which is that, traumatic, just concussion over and over and over. And this is how crazy it was. And this wasn't even too far back. This is when I was in high school, 92, 93. I remember my brother, I have an older brother, and he was a stud in San Diego, stud linebacker. I mean, so much so he was always in the papers, and they always did play on words from his name. It'd be like Shocking Watts hits again, or Electric Watts, this guy. And I remember our rival high school, the quarterback for our rival high school, they played baseball together, like, outside of school baseball, when they played whatever, a pony league or whatever it was called. Friends. And in that game, he knocked him out cold. I mean, knocked out cold, which was like, hey, we have a chance to win the game now. Mm-hmm. Well, that sucker came back in the second half and beat us. And it's like, you would never let a kid come in, right? And even back then, it's like, you'd be knocked out cold, and the trainer's going out there with smelling salts to wake you up, get you on the sideline to see if you're good enough to go right back in. And so, which is wild to think. Where we're at now, it's wild to think that was even a thing. And so there, you can play these sports and still be a lot more safe. Like my kids, we're just at the point with rugby, and they hate it. We make them wear a scrum cap, and like, oh no, the other kids wear it. Me personally, I'm actually trying to get on the board for Idaho Rugby, just to make it mandatory for any high school kid, anybody under the age of 18, not even giving them a choice. Because then it comes down to a peer pressure thing. Like, well, nobody's wearing it. And my wife just says, well, you just tell them that your mom loves you more. But the reality of it is, so with them, it's like, no, you're wearing a scrum cap now. And yes, it's a little bit, but you know what? That little bit can be enough to prevent a concussion.
I think my boys like to wear it so that we could
tell who they were.
Know which one it was.
Yeah. And then my son now, he's had some concussions, and he's in South Africa playing, and even himself, he's like, okay, I'm going to wear a scrum cap going forward. And as an adult, there's even less scrum caps out there, right? But there are things you can do to be safe, and if you see, you are the biggest advocate for your own kid. You see your kid take a shot to the head in the game, or, they're heading the ball and they head, another kid, or there's, you can clearly see that, hey, that looked like my kid's head was hit pretty hard. You're the parent. I mean, don't be afraid to walk out on the field and be like, no, my kid's done. Pull him out. Like, he's off. He's done. And so you're the biggest advocate. And there, like I said, there's things you can do. Supplementation can be very, very impactful. Diet is huge. There's a lot of things. What other little things would you say? Because this is the Shift podcast, right?
Well, I want to ask, like, brain health is something that is concerning. Just should be more concerning. I think it should be talked about more. I think even, you talk about kids and you talk about the frontal lobe, and I mean, even as an adult, I think I take my brain for granted until my mom, who suffered from primary progressive aphasia, which is the same
Bruce
illness that Bruce Willis has.
Wendy Williams.
So it's interesting now for me to listen to what's happening with Bruce Willis's family and the things that his wife are saying, because it's devastating, right? And the brain, not only, I think, do we have this idea that we can't do anything about it because it's just in our brain, or number two, we just maybe take it for granted. Maybe we think it is what it is. Especially going into, as we're getting older. And, you and I talked a little bit offline about, you mentioned perimenopause and menopause, and I think you start to feel something's wrong with your brain. And when we talk about the body and we talk about health, it's a systemic thing. Like, okay, nutrition, supplements, When I was watching Capri go through, and I went down every day with her, and I mean, some of those things that she was doing, I couldn't have done. Like, she would have to do multiplication, add 3 or take away 2 if there was a green light. There's all these multitasking things, or and I've seen people actually on TikTok show the cards that it says the word green, but it's a blue card. And so you play this game of say the word that's printed, but not the color that you see.
Yes.
So kind of maybe talk about awareness that we can have as a for ourselves about our brain health, and maybe even for our kids. What can we do? I know that this term, I hate this term, brain rot. Because it's almost like this little kind of badge of honor, ugh, Mom, I'm doing the brain rot, I'm in brain rot, or brain rot this, and memes about brain rot. And I'm like, you guys, can we not joke about brain rot? Because that's let me sit down and let me binge watch on TV for 6 or 7 hours, 6 or 7 into the middle of the night. And then there's no sleep and there's no movement. And that is legitimately brain
scrolling, and doom scrolling. Yeah. I
just want to talk about the implications of those things on our brains inside or outside of an injury.
Okay, so what I want to do is I want to make sure, we've been talking about our kids a lot, so far, and that's what tends to happen, right? We as parents,
way more worried, way more worried about our kids.
Okay, but I want to take a second because we're all, I know Heidi and I we're about the same age here. I'm perimenopausal, I'm butting up right next to 50. Okay. And, things are changing, right? With regards to, my estrogen levels. In perimenopause, your estrogen just takes a huge dive. Okay. And your endocrine system is a shock. There's just these changes, right? We can do a whole 4 hours just talking about,
so you may have to come back.
I can do that. I'd love to. But I just want to make sure there are some main things that we can avoid doing, and that I think we really need to kind of check ourselves, because we tend to be we just give, and there's almost nothing left by the end, and we need to make sure we can put that mask on ourselves before we help other people, right? Yes. And I know that is a real big paradigm shift, but I'm trying to do it myself too. So one of the big things is we have to go to the doctor regularly. Okay. And when I say this, whether it's, your OB, not your OB, your gynecologist, or it's your primary doctor. I love my primary doctor. He's a really good friend of mine, as well. And we're such good friends that sometimes I'll complain about something and he'll say, "Oh, that's perimenopause." And I'll say, "I don't want to hear that out of your mouth." It's so easy to blame everything on perimenopause, right? But we need to go in and we need to be really open about what's going on. Be open about our mood issues. Be open about if we're anxious about things. Be open about hey, can you just check my blood pressure? Make sure that we're getting these annual checks, because prevention and early intervention really is the key. Okay. So don't brush these things off. Talk to the doctor. because brain health starts with just overall health too, okay? So go to your check-ins, don't ignore any mood changes, okay? The other thing I would say is we have to get physical. Being sedentary is the worst thing we can do. I was asked, I just did a Facebook Live yesterday, and someone asked me, does yoga count as physical exercise? And I said, yeah, absolutely it does, whatever you can do to get out. If it's pickleball, it's pickleball. If it's Pilates, if it's yoga, or if it's just taking your dog a walk around the block. Stay physically active. And I would say try to do something active for 15 to 30 minutes every day, not just every other day, okay? So just try to stay active and get your heart rate going. We got to make sure we eat well. We have to really pay attention to what we're eating. I mean, I notice for myself, I'm lucky if I grab a protein shake and a protein bar and then I don't eat until dinner, and that's not great. Okay, so let's eat well. Let's eat high protein, really good protein. Let's eat kind of smaller snacks during the day if we need to, but we got to keep our brain fueled. Okay, so that's another one. We have to, this is one of the most important ones, I think, is the stress. I feel like we just have lived with a certain amount of stress that we don't even understand how much stress we're under, okay? But with all this extra cortisol, that releases all this inflammation. It can harm our brain, and it can make things easier. Injuries and illnesses harder to get over. It can affect our immune system. So we really got to figure out ways to manage our stress levels, whatever that is for all of us. And then the last one that I'll say is we got to get good sleep. We have to be trying to get between 7 and 8 hours of sleep per night. And there's no amount of daytime napping that makes up for a solid amount of nighttime sleep. I have to say that, when I turned 42, I got my hormones checked, started to feel really tired. I realized progesterone needed to be adjusted. So I got on progesterone, and that was the best thing that ever happened to my sleep. I love that progesterone for sleep, but that has helped me with my mental clarity, with just so many different things. So I just think we need to take care of ourselves. Those are some easy things that we can do to help take care of ourselves. So that's just a kind of a quick, I think those are 5 or 6, 7 different things.
Yeah, that's great.
Oh, last thing, Heidi, we have to monitor our phone usage. We ourselves need to stop doom scrolling. We need to get off these phones, get outside. I mean, I'm not saying don't ever use them, but we really need to set boundaries for that.
Well, we just talked about this earlier before the podcast. We were talking about the phones and Wi-Fi or wireless headphones, the Bluetooth
headphones.
There's more and more research coming out showing the correlation between brain tumors in this. If you go into your iPhone settings and you scroll through there, it'll say right in the settings that the phone should not be held up to your ear. It should be held 6 inches away, 5 or 6 inches away from your ear, buried deep in the terms and conditions. They know that it causes brain cancer. They know it causes brain tumors. And so, plugged in earbuds, keep your phone on speakerphone. You should really try to keep it away from your head as much as possible. One thing I talk a lot about, especially when it comes even with brain health, is brain health also begins with gut health. You make the majority of your over 98% of serotonin created in the gut, and dopamine, GABA also created in the gut. So if you don't have good gut health, you can't even create these neurotransmitters properly, which obviously is huge for the brain. So it's more than just a little few things. Let's do this. Like people understand. There's a whole body approach. Just like you said, diet, exercise. They've shown that sedentary is worse than smoking.
Mm-hmm. Yeah,
they have a higher rate of heart attack or stroke being sedentary than smokers do. Which is that right there is an eye opener. I think for a lot of people, like what? Yeah, right. That person that you're over there going, oh, that person's so unhealthy, they're smoking, and you sit on your couch all day. You're the one that has higher risk. Don't get me wrong; they definitely have their own risk, but yours is higher. So all those things that you said are so important. And the one thing I like, or the thing I like that you said about a lot of these things is it is a whole body approach. Brain health is a whole body approach. It's not just things specifically to the brain. There's all these other things, hormones, all these things that do affect brain health and cognition, And so it's super, super important.
I think that the thing that I'm the most hopeful about, especially watching Capri, because so it's been since February. So we were there in your clinic for 2 weeks in February, and then she was continued a protocol kind of at home, and she started college about a month ago. Yeah. And you guys had kind of explained to her, look, okay, we did this really invasive, not invasive, but really intense 2 weeks. And every night she came home, I mean, crying on the drive home. She was so tired, like really worked her brain. And then it's going to take 6 months of like, let it heal. And let's be patient while we're still kind of doing some of those protocols. And to look at her now, like compared to last year, night and day, she is back super social, doing all of the fun things, playing, pickleball. She is playing pickleball, and she's working in a job, and she's jet skiing with friends. She's doing all the things that she loves again. Her personality is back to where it is, or where it was. I think that the hope is there that there's something that you can do about your brain. You can help your brain. It's not just something happens, it's broken. There are things that you can do. And I love those lifestyle pieces. The other thing that a lot of people ask me about after Capri went is, my kid had this brain injury back in high school. He's been out for 5 years, and he just is struggling with college classes, or struggling with some of those decision-making things. And this mom feeling, multiple actually moms feeling like, do you think it would be worth it? Or is it too late? And I just want everybody listening to know that whether it's no matter what it is in our body, in our mind, it's never too late. I love your point about getting curious and working with your doctor, asking questions. If you're not satisfied with those questions, to dig in a little bit deeper. The blessing of the world that we live in is access to information. I'm going to probably go do a deep dive in your blog, because that intrigues me, to read up on that stuff. But we'll just kind of let you end with,
I want to ask one more question.
Yeah, go ahead.
One more question, just because it just popped in my head as you were talking and saying these things. How common, like you see obviously a lot of patients and a lot of kids, how common is it to see a kid who maybe has been misdiagnosed with ADD, when in fact it's the result, like you said, they have a hard time focusing, and immediately you would think you go in to see your doctor and say you have ADD, you're going to go on Adderall. Have you seen that where somebody was diagnosed with ADD and really it was an untreated brain injury at some point?
Oh my gosh, yes. I see this so commonly, and I feel like ADHD has been really overdiagnosed as of late. And one of the things that I use as a differential diagnosis is, has your child actually had a long-standing history of attentional issues, or did the attentional issues really start or seem to start after a brain injury? Because if it actually started after brain injury, the likelihood of that child actually having ADHD is much, much lower. Okay, what they probably have is significant attentional issues, but secondary to the concussion, versus like a congenital or a childhood ADHD issue. And the problem, though, is that for a lot of patients, a lot of kids and adults, if you take a stimulant, your brain's going to be on fire. Your brain's going to feel good because it's a stimulant,
Right.
And so sometimes you say, well, yeah, but I'm better on ADD meds. I'm like, well, yeah, so is everybody else, but that doesn't mean that you actually have, ADHD. And so I am very much not a huge proponent for medications for our youth, especially with their young, growing and developing brains. And so just be really careful that with these diagnoses that are being thrown at your kids, especially if they've already had a brain injury. So sometimes it takes you as a parent saying, well, is it really that, doc? Because they didn't really have this before and now they have it. That is probably the biggest difference, is if they never had the issue before and then now they have it, then they should not actually be diagnosed with ADHD. It should be more of an attentional deficit, attentional issue secondary to the concussion. And one is much easier to treat than the other.
And that's going to be the follow-up question. Is that something that's treatable? Because I'm sure that there's people who are listening to this podcast that is like, oh my gosh, that's my kid. So let's before we end here, why don't you go into that, because I know this will be a big one. We definitely need to have you back on. So this really and maybe that's my fault. We kind of dug right into the kids, but we definitely need to have you back on to talk about brain health for people like us. Like I'm 49, and in this age and what we can do. So, but if you want to go ahead and tell us what can they do with that, and then we'll let you. And
maybe just what it looks like to come to your office and and get help.
Sure. So I absolutely know that we can help attentional issues. So with the fMRI that Capri did, and that we've had over about 8,000 patients now throughout my career. We have so much data about what your brain is supposed to look like when it's doing an attentional task. And if you're struggling with attentional issues after brain injury, well, join everyone else that just had a brain injury, okay? You're not alone, although it can feel very isolating. So just know that that's one of the cardinal signs and symptoms of a concussion or a traumatic brain injury. And when I say traumatic brain injury, I also don't want to leave out long haul COVID. We're seeing a lot of COVID long haulers. We're seeing a lot of patients with mold exposure, neurotoxicity, stroke, chemo brain, so it just runs the gamut. Brain injury runs the gamut, okay? But if you do have any cognitive issues or deficits after a concussion, a vast majority, if not most of them, if not all, could be improved if not healed, okay? Especially if you just have a concussion.
Exciting. Yeah.
Yeah, and you're right, Heidi. I think we need to end with this a lot of hope, which is, the reason why so many patients, just like Capri, also came in and did a structural MRI is because if I see your brain and it's structurally very normal, there's no white matter disease, you're not missing part of your brain, everything is otherwise quite healthy, then there's every reason for me to believe and assume that your brain can heal itself. Okay, you don't have to be this way. You're not stuck, just like Capri was not stuck. Okay, but it is going to take more than just rest. Okay, rest is not the answer. We need to actually rewire that brain and get that brain healed. But it can happen. It doesn't matter if your injury was a month ago or a decade ago. We've seen patients, where their injuries were 4 decades prior, and so the brain is plastic. The brain wants to change. All right, and we can do that. So what does it look like? If you go to our website, and I think Heidi can post that, but it's www.cognitivefxusa.com. You can click a little Get Started button, and we do free complimentary consultations with me or another doctor or my clinical director, who's a nurse who I've trained, and she's wonderful. But you'll meet with us, and it'll just be like a 30-minute one-on-one like this to really see if you're a good fit for what we do. But I think that's the best way if you're really interested in maybe even just getting a scan or interested in getting more information.
And I know that when we were there, your staff is incredible. Everybody is just incredible and passionate. And because it isn't covered by insurance, I know that you guys have solutions and payment plans and ways that you work with people. And when I was there, there were people from all over the world that were coming, and you could see the change. Like we went every day for 2 weeks. So I saw a lot of people in different stages. They were seeing change, feeling change immediately, which is really incredible. And so, my gosh, thank you for your work. And I felt really, it was just such a gift to be able to work with you guys. And it's just even to watch Capri, I think I'm so grateful that she was able to get the help that she needed. And I know that there's people that maybe just feel a little helpless, don't know where to turn. And so just keep, asking questions. So thank you so much. And you just keep changing the world.
One brain at a time, right?
One brain at a time. Thank you for being here.
You so much. Thank you, Heidi. Thank you, Dr. Vohn. And happy to be here, honored to be here. Let me know if there's ever a time you want me back.
We would love that. All right. Take care.
Bye-bye.
Thank you guys for being with us.
There's a lot to take in. It's a lot to digest.
We talked about a lot. And I think that I found, like, as I was sitting here, I found myself, my heart rate kind of go up and then I would try to breathe because I think that, this is one of those things, like if I had a magic wand, I would want insurance companies to consider the brain part of our body.
Here's the real deal. I'm just going to be candid. Some of the best doctors, some of the best specialists, they're doctors like this doctor, Dr. Fong, functional medicine doctors that insurance doesn't cover. And that should kind of tell you something, that insurance only covers stuff that, people struggle to, actually is really, they struggle to get truly better. You get on the treadmill. You get on the treadmill of health that you're stable so long as you do this medication or this medication, but you never get better.
And I can certainly, when you certainly understand the challenge, that our country has in this situation. And a lot of people that I talk to, no insurance coverage is what's holding them back from being able to explore those concerns. And I get it. And unfortunately, I'm self-insured. Costs a freaking arm and 7 legs.
But you know what? But you have these doctors, you're going to get real results.
Right.
You know what I mean? You're going to get real results. You're going to, there's hope, because those are the kind of patients I saw too. They come in and I was the last ditch effort because I didn't take it. Insurance doesn't cover it. So they always wait until the very end. And by the time they come in to see me, there's no hope left. And so seeing the hope come back in their eyes when they start feeling better for the first time in many, many years, that's what made it all worth it. And I guarantee you Dr. Fong is probably the exact same way because there's people that probably come to her clinic that have had brain injuries and who knows how long they've been dealing with it and probably getting hope for the first time again. So.
Well, and it is pretty interesting. You can follow Cognitive FX on Instagram. And occasionally they'll have people that will kind of share their story or that are some of those college athletes. And there's a lot, it's inspiring to see what they do there and some of the protocols that they use. I know a lot of what they do is proprietary. And I was kind of told, what I could share, what I couldn't share. And I'm sure that I wasn't comprehending what was really happening, but
some of that stuff you probably,
But I'll tell you that
difficult to really even understand.
Every day, I think there was 2 times a day that Capri throughout the day, they put her in in 45 minutes of exercise because it was so important to get blood flowing through your head. And
blood is what heals.
I don't know if you caught.
Blood is what heals.
And one thing that she said is oxygen is the most important thing for your brain. She said that in the very beginning. And
what gets oxygen to the brain? Blood.
Is blood. Yeah. And so that's why being sedentary, and right now from here, we can talk about depression and we can talk about anxiety and we can talk about that isolation. And then when you start to lack confidence and when you start to doubt yourself or think that you don't matter or start to retreat, retreating and sitting, and she called it cocooning, that That's what we don't want to have happen.
Well, and you know what? I mean, the research shows this is clear. This is clear. This is not natural medicine versus Western medicine. The data is clear. The number one thing you can do for depression is exercise, which is you're getting the blood moving.
It's the number one thing you don't want to do.
Right.
When you're feeling depressed.
And exactly, right. And it's great that she talked about how, because that's like, I remember my son getting concussions in high school and it was like total in his room for 2 weeks, And looking back, it's like, yeah, you really think about, man, that is really dumb. Because it was the same thing when somebody got back surgery. And I remember when I was a kid, my mom got back surgery in like the early 80s, mid 80s. And she was like laid up in bed for a month. And then they realized, oh my gosh, that's the dumbest thing you can do. Well, and now they try to get you up and going.
That day.
My dad had hip surgery and they had him up walking that same day.
Yeah.
And it's taken that long to catch up. And this has been years since medicine has gone to that. And now they're just barely catching up. And actually they're not caught up because they're still telling you go to your doctor, you go to your pediatrician, you go to your family doctor. And probably most neurologists, neurosurgeons, whoever you're going, probably neurologist, they're telling you to stay off your screen and stay out of light. And they're still telling you that, even though the new research is showing, no, you need to be moving, get that blood moving.
And sometimes we love like the history of this is what you do. Like, this is what my grandma, this is what we did. And sometimes it's hard to make those adaptations.
And sometimes the historical things are totally correct.
Right.
But some of the stuff too, we have to be open. And that's one of the things I hope we really are able to garner in this podcast is that we're not here for people to just believe us exactly what we're saying. We want to just empower you with information. So then you will go and do your own research. Like we were talking about back when we were talking about cholesterol, right? The latest research out of Sweden. So it's like, go read the latest research. Just like Dr. Fong was saying, the latest research is showing you need to get up and be moving. But how many doctors are still prescribing because that's what they were taught in school. And it's not any knock on the doctors that that's what they've been taught. But nobody's responsibility for your health or your children's health is not the doctor, it's you. And the only way you can truly get that is to be educated and to be willing to go look at the research. Be open-minded enough to go, hey, I wonder if there's new research out there. Anybody can go to pubmed.gov and type in anything about any health issue. And that's the PubMed, P-U-B-M-E-D. PubMed. Yeah, that's the NIH. That's where all the research from the NIH, that's where all peer-reviewed research, tons of medical peer-reviewed research is right on there. Anybody can go on there and look. And at this point, it's even more than that. I mean, now with ChatGPT, all you have to do is go in and say,
how to do that.
Provide me all the latest research and the links that have to do with ABC topic. And it will search the whole World Wide Web, and then it will come up and it will give you links that you can go and look at.
Would you like me to make this into a graph? Would you like me to break this down for you? Like, you're like, yes,
let me create a PowerPoint for you.
Would you like me to put this on a PDF?
My point is,
I want you to email my kid right now. I want you to text my kid. I want you to make a TikTok for my kid, so that they will listen to me.
But the information's out there. So like I said, this is just more of a space where you can come to hopefully learn some new things.
Get curious.
Get curious. Don't be offended. Get curious, because you might say, "Oh my gosh, Dr. Watts, he's crazy." That's okay. I wouldn't be the first time somebody said that. But you know what? Tell me what I'm crazy about, and I'll show you the research to back up everything I say. There's not a single thing I say
I love that
doesn't have, that I can't provide peer-reviewed research. Now, it's a magazine article, actual research. It's out there, and there's a lot of new research. Just go read it. I mean, because at the end of the day, especially with this group that we are speaking to, you are the first responders of your home. You are the one that decides the food, the drinks, the medicines, the nutrition, the supplements, the chemicals that come into your home. So wouldn't it be important to be empowered with knowledge and information and not just listen to us or anybody else, or, just get curious and then go get empowered?
Every time I just kind of go, okay, it's good. And I think that you got to take it not as like another thing you got to do. You got to take it as like this. I'm curious about this, and just being here and listening is a shift, and then it can start from here. So thank you for being here. All of us know somebody who has a head injury, who has had a kid with a head injury, who is concerned about it. Tell them about Cognitive FX. Dr. Fong is literally just blazing the trail. And so I want to do anything to support her and her research and what they're doing, because I hope that it's just going to grow and make it more accessible for those who need it. So if we support them, they can grow. So anyway, thanks for being here, and come back again next week, and we'll keep talking about all the good shifts.
Founder of Foundational Wellness, shares his insights on how the body functions as a whole system, along with the principles he uses to help people get on the path to better health. Please remember, the information shared on this podcast is for educational and informational purposes only. It is not intended to replace medical advice, diagnosis, or treatment. Every person is unique, and your health decisions should always be made in consultation with a qualified healthcare professional who knows your individual circumstances. Neither Dr. Watts nor this podcast is responsible for any actions you choose to take based on the discussions in these episodes.